thing that we can use for our patients that are infected.
What are our numbers like today? Or at least last night? I don't know.
So
I haven't
last
seen the
night-
numbers yet.
Yep, and we're waiting, and so we still have around about 33 to 35 patients in-house. Now, we have had some discharges, which is good, and we've actually had people who've been extubated who were in the ICU, so that's good as well. We currently have around 9 patients on the vent, and there's always about, currently 15 to 20 who we are ruling out in the hospital, so.
Yeah, we're seeing some patients come off the vent, which we're really happy to see, because there's been some prior reports that was difficult to do. But Karin, this is a difficult patient population, and some of the work you're doing in your team is critically important for us.
So, a lot of what we've been working on right now is trying to overcome how hard it is on the patients and families to be separated in this time. The visitor policies to keep everybody safe make it very hard to be together. And so our team has been working a lot on strategies for making sure that we're using telemedicine the very best we can to try to bring those patients and families together.
Yeah, and done a great job. Thank you very much. I think joining us today is also Mitchell Douglas, who I mentioned a moment ago. Mitchell, are you out there?
I'm right here.
Great. Tell us a little bit about some of the issues that are especially important in the in your field.
Well, the kind of the reason I really want to get a chance to talk with you guys this morning, what we're seeing over at Marillac, and Marillac is our inpatient child psych hospital serving kids 4 to 17 years of age, is typically this time of year we are seeing 10, 15, 20, 25 assessments for individuals at high risk of suicide, and that was what we've been seeing trending over the last multiple years. We've seen that number dip precipitously over during the coronavirus pandemic, but the patients we are, because we're still open for business, but what we are seeing is the patients are coming in after very severe near lethal suicide attempts, and I'm very worried that there are families out there with children or adolescents who are showing warning signs that they are at risk for attempting suicide. But the families are concerned that they're scared to come to the hospital for fear of the coronavirus. And that's a hard debate and question to have, because we certainly want to be respectful of and honor the instructions to engage in social distancing and not come to the hospital if you have to. But I want to maybe take a moment now or during this time to talk about things we're doing in our facility to mitigate the risk of infectious spread if a child needs to be in the hospital, and making sure families kind of think through, if you're worried that your child's at risk of harming themselves or killing themselves, and that's one of the leading causes of death in the adolescent population, that they take that risk seriously, consider giving Marillac or any facility a call the suicide hotline or go to a local ER.
Mitchell, I think you should go ahead and tell us a little bit about that now. And just to say, we spend a lot of time about talking around the direct harm of coronavirus or the primary harm. This is the collateral or secondary harm. What are the downstream effects of having to do social isolation, not being able to be out and meet your friends and family, the things that Karin's mentioned, the things that you just mentioned? It feels like there's a real tie there. What are some of the things you're doing down at Marillac to try and make sure infection control is strong so patients don't have to worry about becoming infected with coronavirus if they're there, or family?
And so, there's always no 100% guarantee of anything. That said, every patient who's in our facility is having their fever checked twice a day and immediately placing precautions if there's any evidence of fever. Every staff member is having their fever checked before entering the building. Any visitor person who's going to enter a building for whatever reason, and we were limiting all of our visitors, is having their fever checked as well. Our staff are wearing masks per KU's inpatient guidelines, so a lot of our staff members are masked up. We have increased our environmental services protocols, making sure that we don't have surfaces are all cleaned. We're reducing fomite spreads. We've changed our dining habits and our dining procedures so that patients aren't getting together in the dining hall, but rather that they were sitting separate from each other in a spread out space. So we've really tried to think through exactly what we can do to make sure at all times patients are staying 6 feet away.
Yeah, all really important things. And just to say, Mitchell and I share a little bit of geography. He went to the University of Rochester, New York, for medical school, I think. I was there as a resident. I dare say I was there long before you were, however.
It's conceivable.
Yeah, it is. It's more than conceivable, I'm afraid. Karin, those are all the things that you have to worry about in your field as well. and the use of telemedicine to connect to families because visitors can't come in for these really big discussions.
Yeah, if I were thinking about what are the most important things that people can do right now while they're social distancing, beyond all of the washing hands and et cetera, is talking with your loved ones about what's important to you in your living and maintaining that connection with them. Talking with your doctors, especially folks who are living with serious illness already, talking with them about what they would hope for in management of the condition, but also what your providers would worry about if you were to get really sick from COVID-19. I think the more people can do to prepare themselves and their loved ones in this way is just really important right now.
Yeah, I think that, gosh, that just feels and rings so true. So out there to our audience and listening audience, questions that you might have for anyone here on our panel today.
Yeah.
Good morning. Go ahead.
Hey, this is Mike Sherry at KSPT. You had talked about the ventilators and things and getting people off. How are you guys doing in terms of capacity of ventilators?
We're good. We haven't really hit the surge. We're probably still in that ramp-up period. So with our prior cancellation of elective surgeries and other things, we really have a lot of ventilator capacity at the moment. Now, again, that could get overwhelmed if things do ramp up, but at the moment, we're in good shape. Other questions?
Cher from
with Casey.
Fox 4.
Go ahead.
Oh, thanks. I actually wanted to talk about trials if we could for a moment. We found out yesterday that St. Joe had actually been approved for trials, and you had touched on it last week. Could you talk more about the trials you've applied for, how that process works, if you've been approved, just the trials in general?
Yeah, I know one trial we're doing is losartan, which is an older medicine. It's a blood pressure medicine that that may block some of the things that coronavirus latches onto in the lung. And so we are about to go into that study. I think that just got approved, or I'm pretty sure it's being initiated right now. So that study's ongoing. We also are going to be starting a study looking at healthcare workers who can take hydroxychloroquine as a prophylactic measure. And Dana could probably talk better about that than I do, as a way of preventing transmission to healthcare workers to see it do it. That's a 15,000 member trial. One of our investigators, a couple of our folks, Mario Castro and Dr. Salate, are leading on that. And then I know there's some other trials too that are being looked at, Dana.
Yeah, from day one, we've had a very good therapeutics group with infectious disease, critical care, pulmonary medicine, and our ID pharmacists as well, who've helped get these trials going, get enrolled in trials, but also be available to try and get other medicines such as remdesivir for trial. That's very hard now with the manufacturer, but from day one we have been busy creating criteria, trying to get in trials for these medications just to see the efficacy and the safety of them, and we are still going forward.
And we've been on a hydroxychloroquine as a azithromycin protocol to look at outcomes around that. And then I know that there is a plan to obtain some equipment that allows us to monitor the release of those things that cause the really organ issue, what we call cytokines and inflammatory mediators. Big words, but what they really are things that your body releases to fight infection. And sometimes in the middle of an infection, things go a little haywire, releases too many. That causes a lot of other damage. There's a drug that may block some of that, tocilizumab, but we're trying to find signs of that early, and so we have some equipment that's going to allow us to make that early and get people on to tocilizumab protocol. So a number of things we're doing, as well as different approaches to mechanical ventilation. So lots of stuff out there.
Yeah, to go with that, I mean, not only the medications themselves, but the timing of the medication. So hopefully these new trials with looking at the cytokines will help us initiate the medication at the correct time to see if there's any benefit as well.
Yep. Other questions?
Are you guys seeing any difference with people coming in for the treatment of heart attacks? Because I know there was a report out this morning saying that when they did kind of an informal poll of cardiologists, that there's a 40 to 60% reduction in admission. Is that something you guys are tracking as well?
Yeah, we don't have as many admissions for this, and I'm not going to try. I'm not smart enough to speculate on the reason for why that's true. Maybe people aren't exercising as much, or maybe they're home taking their medication because they're bored and don't have anything else to do, or I don't know right what the full answer is. But we don't, our admission numbers down, and some of it is surgery, like surgery. Sometimes people aren't coming into the emergency room as often. What I'm a little concerned about is what this looks like on the other side, because you don't know how much you're pushing off and how much will recur. But living through a pandemic is a fascinating, I mean, that sounds terrible. It's a terrible time, right? It's a terrible time. But there is so much to learn from it because we're seeing such changes in behavior. And what does that mean? We're going to be talking about this for decades, I think, about what it meant to the American healthcare system, because our elective surgeries decreased by themselves to explain the full drop in our census. It's true around Kansas City. If you look at all the hospitals, we're all low in terms of capacity relative to where we normally are at this time of year. And I think the good news about that is it gives us the opportunity, if there is a surge, for us to, be ready for that. But it does lead to a lot of questions. Mitchell, are you seeing the same thing over in the
I mean,
you guys are down?
Our numbers are probably down 30 to 50% than what they normally would be.
Yeah.
And kind of phrase it, like this is my worry is the secondary damage which is happening where people are afraid to come to the hospital. We don't want people in the hospital if you don't need to be. Just this, a really hard position for a family to be in if we're talking about, adolescents and suicide. How do you make that call and how do you make that decision?
The other thing
I certainly encourage, making the phone call, talking to your doctor, talking to your providers, and making sure those things get addressed.
Karin, do you think the lack of having visitors and being afraid to be in the hospital alone is keeping people out of the hospital who might otherwise be here?
I mean, I think there's probably, as you were saying, probably a lot of reasons why, people aren't coming, trying to stay at home or being afraid that they could get sicker at the hospital. I think it's so important to know all of the efforts that the hospital takes in order to make sure that this place is safe for the patients and for the providers who are here, so that people know when they need help, we're here and we want to help them.
Yeah, and Dana, I'm just going to say, good hand washing, social distancing, that affects every infectious disease, not just coronavirus.
Yeah, I mean, that's the basics of infection prevention is hand washing. And if you can social distance, I was asked that question earlier, and I've continued to say my answer is, do I think I'm going to get COVID or infected? Probably, but it's not going to be in the hospital. The hospital is a safe place. We have taken the utmost care to protect our patients and to protect our healthcare workers. You are certainly probably more at risk of getting the infection in the community, at the store, doing other things like that. So if you're ill and you need to seek treatment, absolutely come to the hospital to get that needed treatment.
And I'll just say, it is still incredibly important to accomplish all this social distancing. Remember, there's a big holiday coming up on Sunday, right? And Friday night, Good Friday, and Easter for the Christian faith on Sunday. What do people want to do on those days? Especially on Easter Sunday, they want to get together.
Congregate.
They want to have a dinner. They want to congregate. And gosh, you see this being said by a lot of religious leaders as well. And the thing is that it's still, you have to be so careful with it. And so whether you're in Johnson County or Wyandotte County or Jackson County or Clay or Platte or Shawnee or Douglas or wherever it is, the answer will still have to be the same. Shelter in place, stay home, keep your distance, don't wash your hands. No, I just said don't wash your hands. I meant wash your hands. Don't touch your face, and do those things that we know make a difference. And if you let up on the gas for even 1 minute of one day, we can really take what right now may be some early evidence that we could be flattening the curve and change it into a real surge. So just be really thoughtful on these big days, including on Easter Sunday.
And I think look at it like this. We want you here for the next holiday in your religion. So if we can,
or in any world, 4th of July. I want to go outside.
4th of July.
4th of July, and I still want it to be at Royal Stadium. And I don't know if we'll be doing it, but I really want it to be true. So, next question.
Hey, this is Nate from the health system. I have a question from Facebook. Is the reason some people are not feeling great after 10, 12 days from coronavirus, is that due to a secondary bacterial pneumonia? Due to the virus attacking the lung tissue?
Great question.
Okay, Dana.
Yeah, that is a very good question. So when people aren't feeling great, I don't know exactly what they mean by that. Are there specific symptoms? Certainly we know with influenza, certainly we knew in 1918 influenza pandemic, a lot of those people died because of secondary bacterial infection, bacterial pneumonia. For some reason, you may not feel well after this virus, again, because it's a new virus. Your body is still recovering from it. If you have specific symptoms, specifically about bacterial pneumonia, you'd probably have increasing shortness of breath, chest pain, high fevers again. We haven't really seen a lot of the co-infections, the bacterial superinfections with this disease as we have with influenza. Certainly it's a possibility, never say never. There have been reports and even some fungal pneumonias. But in general, the chance of you having a secondary bacterial infection with COVID is much less than, say, with influenza.
Yeah, and we don't know all the reasons for it. Maybe it's how the actual etiology of the lung damage occurs with coronavirus. But what we're seeing is a lot of patients do take a longer time to feel good.
Better.
There's a difference between I'm infectious and I feel terrible and feeling good. And coronavirus probably has for a very interesting recovery, because in some people, especially younger and middle, well, I'm not middle-aged. Yes, I am. I'm advanced middle-aged. But people, between very young up until the 20s or 30s tend to have a much easier course with this. Now, not all together, but they tend to have a little bit easier course. They may recover a little faster. Others take a little longer. We're seeing some of our initial patients in follow-up who still are not feeling perfect yet, clearly better, and we'll try and get one of them on the show sometimes and let you visit with somebody who's recovered or recovering from coronavirus. So, other questions?
Yeah, this is Mike from KCT again. Can you talk, this is down the road a little bit, and hopefully you are flattening the curve and things.
We're really not talking about that yet. We're just saying maybe.
Yeah, well, so talk to me a little bit about, and this sort of goes to Dr. Porter-Williamson's expertise. Talk to me about the triage approach. What's going to happen if, there's a shortage of ventilators? How do you handle triage?
Great question. Okay, KPW. Sorry, I've been under different names for a long time. I'm sorry. Carmen Porter-Williams at KPW just kind of spills out.
It's all right.
I know.
I wouldn't know what to do otherwise. Fair
enough.
Preface it to say that everyone's first goal is to do everything possible to avoid a situation where that question becomes a reality. And so there's an awful lot of work going on to make sure that capacity everywhere is maximized so that we don't come to a time where there's a question of not having a resource that we need to help save somebody's life. So I think that's and the more that we're able to do well with social distancing, this is everyone's responsibility to do good social distancing so that we keep ourselves far away from that discussion. And so I would say that talk about triage protocols we would like to maintain as theoretical forever. That being said, if it were to come to a time where we were out of resources to help, then there is a broad coalition of medical providers, medical ethicists, nurses who are working to say how do we in the very best way possible figure out how to save as many lives as possible in a really horrible situation.
And the state of Kansas has had some guidelines around that. The military's had some guidelines around that. So I know we've been able to look a little bit at those. Have those been helpful to you at all?
Yeah. Dr. Simpson here was part of the Kansas
planning around
Kansas
that.
Planning.
Yeah. Steve Simpson's one of our public critical care docs.
Now there's a lot of work going on nationally to understand how what makes sense in specifically related to COVID-19, and we're learning more and more all the time about how we can best help the people who get it, and understand how do we do everything we can to save as many lives as possible.
Yeah, and I know one of the challenges of pulmonary medicine is even saying, gosh, are we better off making triage decisions, or are we better off trying to hook 1, 2, 3, or 4 patients up to one ventilators, which you could hurt multiple people if that ventilator fails, or you make a decision and maybe one person doesn't do as well and one has a ventilator. And those decisions, like you say, if we socially distance, we can really flatten the curve. We don't have to make those kind of decisions. But I think you look around the world and you see places where those decisions have had to be made, are being made. And gosh, we're going to hold our breath and pray and hope that's not who we are. So, next question.
This is Taylor at 41. We talked about masks this morning a little bit with Dr. Hawkinson, and you mentioned this one, Dr. Hawkinson, about people putting filters inside the masks that they're making. I had not heard of that idea before. My wife suggested it a couple days ago, and she even bought a filter to cut up and put in the mask that she's making. I know you're not going to say that's overkill necessarily, just because of the way you've described some of the other actions people are taking.
Right.
But is there a way to do that incorrectly? Is there a filter you could pick that might do more harm than good? Is there a way to do that that's probably not great if you're going to choose to take that extreme measure?
I don't have much experience or any experience in making these. I haven't looked at any videos for making or really any instructions. I think that with the filters, you have to be careful because you don't want it too stringent that you're going to suffocate yourself if you put them on there. I just know what I've heard and that people have used other things like air conditioning filters. Now, some of those micro filters are it's pretty difficult to get air through them. I know they've used vacuum cleaner filters. Even some of the other types of masks, I think there's an N99 or an N100 or, that's supposed to filter out a lot of particles, but that makes it very difficult to breathe. So I don't have really any other specific recommendations.
Be really careful making up a filter. It's very different to have a filter on your air conditioner, your CPAP machine, or something like that, and then sticking it into a cloth fabric and then trying to inhale through it. You may not know what you're inhaling, and that may be bad for your lungs. So just be really thoughtful. Just because we don't know doesn't mean it's safe. It was kind of like vaping. Oh, we don't know if it's safe. Oh, wait a minute. No. That's like really bad. And so be careful with what kind of filter you make up and throw in there. I would be a little hesitant around that. Not to mention, we have absolutely no idea, unless you're going to figure out and look at every single filter and really do some research studies around it to see if it's really doing anything for you. And those filters are not going to be, unless you get a really big filter and you cover the entire massive filter. And then again, I go back to point one, is that filter good or bad for your lungs? We just got to be really careful with some of this stuff that may sound good on the surface, but if you really start thinking about it, probably not a great idea. So just tell your audiences to be really careful with the kind of filters. If you're going to try and do that, go to the CDC website, look at their guidance. I don't think you're going to find a lot of homemade filters in it.
They were even just bandanas or scarves.
Yeah, I mean, the whole purpose of this is to make sure your secretions don't get on others, not to try and prevent you from getting them. Those biologic masks, those surgical masks you see people wear, you think that's a simple device. It's been around for a long time. I can't tell you how many times that got tested and modified and things like that to make sure they were safe. So be careful with the homemade filter thing.
I think the other thing about that is just knowing I didn't pay attention before earlier in my life about how much I touch my face.
Yeah.
And so, when it comes to the masks, when you have the mask on, then you may be itchy and you may want to mess with it. And so if we're not really careful about the mask, whatever it's made of, you could end up touching your face more and actually causing more of a problem.
Yeah, but I'm going to challenge for you. This is now I'm going to sound like I'm old-fashioned, which maybe I'm not. Actually, I'm not. So go look at next time you Zoom with a call with both men and women in it. Watch how much more often men touch their face than women. Because I think women are taught at a very young age with makeup, but different things. Don't touch your face. And guys, we're slobs, and we do it all the time. And so just watch for that. Just a little entertainment.
So you said a good word.
Slob?
No,
Okay.
Zoom.
Zoom. Yeah.
And it may not all be Zoom, but in terms of platform communication, I've been thinking about what are the best ways to prepare now. So having a Zoom account and knowing how to use it, having those things downloaded. when I'm taking care of somebody in the hospital, one of the first questions that we're asking is, what kind of phone do you have? Does it have a camera on it? Does it have a microphone? And how do we help facilitate? And so when we're able to get the technology set up, then we're able to connect them with families, but also connect the doctors together with the patients and the families to meet. And these platforms turn out to be a really amazing way to bring us together.
Yeah.
And so it's physical distancing, but it doesn't have to be social distancing where we're not being social. We can still be together.
I think that's a really good point. Other questions?
Mike Hendricks here from the Kansas City Star, and I too am advanced middle age.
It's a great time of our lives, Mike.
Say, can you address the concerns about false negatives on these tests?
You bet. And Dana and I both are going to sing from the same songbook here about it's not so much the test as it is the swab, Dana.
Yeah, and I'm not sure exactly what test you're referring to. The tests we use here, and most of the tests available, are nucleic acid tests or DNA or PCR tests. We certainly have had very good experience here. There's been that in the media, or it's been touted as the false negative rate. It's really difficult to tell because a lot of these tests are new. What I can tell you is from our experience here, from a few dozen tests where we've run one sample and then run a second sample on the same patient a little bit later, those tests have been the same. Those results have been the same.
100% of the time.
100% of the time. So here we have very good record for having sensitivity, specificity, and our test results being concordant with the first test result. But that also goes back to, we believe that people taking the sample, doing that test where it's like a brain biopsy to get a good sample is adequate, and that's probably the most important part at this point.
Yeah, if it doesn't hurt, it's not right.
Yep.
Yeah, and it's the other thing is the swab has to be right. Some people are substituting swabs because they were running low on those. We actually got a shipment yesterday.
Yep.
Yay! But if the swabs are supposed to be a little bristly, and they're supposed to be put back pretty far, and they're going to hurt. And if they don't hurt, it didn't work. So I think that's probably the larger cause of false negative results.
And then the other thing, so that was our nucleic acid test, our PCR test. I don't know if you're maybe asking also about the serology or the antibody test. That is something that's been newly touted in the media as well. We look to use those. Hopefully they will be very helpful moving forward to evaluate who has been infected, who hasn't. At the current state, though, they are not going to be very useful for determining acute infection. There's also problems because they are so new. They still have to be validated for sensitivity, specificity. You want to make sure that the antibody that you're detecting is actually to SARS-CoV-2 and not another coronavirus, and that has happened as well in some of the studies.
You have to remember the FDA is pushing this stuff through a lot faster than it used to, and because of the pandemic, they're letting equipment out that hasn't been as validated as it has historically. So especially around the antibody tests, be very thoughtful about what that's going to mean. So other questions?
Thank you.
Yeah, this is Nate also with the health system. I have a couple of questions here that are unrelated, but they talk about medication. One person wants to know if it's possible to put to rest rumors about the efficacy of hydroxychloroquine. Do we or don't we have evidence? And then the other question is it true that ibuprofen versus Tylenol makes you at higher risk for COVID-19?
Okay, Dana. Hydroxychloroquine, which one do you want me to? Okay, so here's the bottom line for hydroxychloroquine. We don't know. Not the answer people want to hear, but the truth is the evidence is conflicting. It's small studies. There's not been a large randomized trial. That's why we're all participating in these big trials, to see if it's going to really be efficacious or not. And we won't know if it's effective until we get the results of that. So right now, some evidence says it is and some says it isn't. And then ibuprofen. What are you telling about patients with ibuprofen?
So I think ibuprofen in general, if you're taking it once or twice, it's not going to harm you. We know that these types of medicines, ibuprofen, NSAIDs, are non-steroidal anti-inflammatory medicines. If you are significantly ill, they can have deleterious effects or bad effects, most notably in the kidney. So if you're taking a lot of it, we know that especially if you're critically ill or very ill, you could have problems with renal failure. So we tend not to give those in those circumstances. If you're otherwise at home and you think you have COVID or you have another illness, 1 or 2 doses is probably not going to harm you. And there was even a statement from some other groups and societies saying there is no compelling evidence that using ibuprofen is harmful. But we know that from other illnesses and other illness states, using it in the wrong circumstances can be harmful. And so that's nothing new to us.
Yeah, my back hurt yesterday because I have advanced middle age and I tried to run a little bit this morning. And you know what? I took some Motrin. It felt a lot better.
Yeah.
All right. I think we're going to have to wrap up this today. And I want to thank everybody for doing it. Mitchell, any other thoughts that you would have that you want to make sure audiences and the media partners hear today?
Just make sure that, the message to providers, if you're doing Zoom screening for children or adolescents and seeing them over tele, don't forget to screen for mental health issues, actionable steps, families or individuals out in the community. Check in with your kids. Make sure that they're doing okay. It's okay to ask questions about depression, ask questions about self-harm. And if you're concerned or at risk, give Marillac a call the suicide hotline, take some steps to keep these kids safe.
Thanks, Mitchell. Carmen.
Thank you.
I would say there's no time like the present to do good advanced care planning, understanding what's important to you and your loved ones, talking with your parents about this if they suffer from advanced middle age, even young
Thanks.
people
Suffer.
though.
I like the way you said suffer. Nice verb there.
live and thrive. And it's important for everybody right now to just be understanding what's going on and figuring out what's most important in our living, and then talking about it and writing it down and picking somebody who in your family or somebody who you love and trust who could speak for you if you were so sick as to not be able to speak for yourself.
Thank you. And by the way, it's really advanced adolescence, which is why I can be a Trekkie.
That's right.
Okay, Dana.
Yeah, I would just like to thank our guests here. With coronavirus, or alonavirus, as my friend likes to say.
Alonavirus, that's good.
If you're not infected, you're probably still affected. And it doesn't just affect you physically, it affects you emotionally, spiritually, psychologically. We have great providers and services here to deal with that. It's tough for sometimes as adults to comprehend and process these things, even much more for an adolescent or a child. And so we do have these services here for palliative medicine and for child psychological services and suicide prevention as well. And please utilize these, and please do your research to know where those services are available for you and your community, but we do have them here, and please utilize them.
Special shout out and thanks to Michelle for helping us today with interpreting, and appreciate those services so much. It's how do you stay alive? How do you thrive? And whether you're in Wyandotte or Jackson or Johnson or Shawnee or Douglas, Leavenworth, Clay, Platte counties, or Kansas, Missouri, or anywhere you are out there, it's really the same thing we say every day. Keep your distance. Stay home. Wash your hands. Touch your face. Cough into your elbow. Take care of your family and loved ones. Ask them how they're doing. Thrive. Stay alive. And remember, there's no place like home. Thank you all.
Thank you.